Hello, everybody. My name is Evelyn Lilly. I am a dermatologist at Massachusetts General Hospital. I am here to speak to you about the skin, hair, and nails and Myri syndrome. First of all, I want to say thank you for joining me virtually. I'm sure, or I'm hopeful that it's a beautiful summer day wherever you are, and you're taking time out of your day to listen to me. So thank you, thank you, thank you. So moving on to the talk, I want to first say that I don't have any conflicts of interest, meaning that I don't consult for or work for any companies that have any medications or products that we'll be discussing today. Also that I will be discussing the off-label use of certain medications and products, meaning that these medications and products haven't been tested specifically for what we'll be talking about today. So we don't really know the full safety profile and results for the products I'm discussing. They have just been tested in a small amount of people. So you may be asking, what is a dermatologist? Hopefully you've had the good fortune of not having to see a dermatologist so far. Dermatologists are doctors who study skin, hair, and nails. And a lot of our day-to-day jobs are to look for skin cancers. And so to that end, we prioritize sun protection a lot. You can spot us out and about in the real world because we're usually the ones at the beach in a hat, in long sleeves, pants, under an umbrella. Sometimes I even go to the beach at 4 p.m. after the sun has already gone down. So here you can see a picture of my daughter and me at a beach, and I am woefully not in a hat, but my daughter is well protected. So in addition to skin checks, we also help people with rashes. We diagnose and treat rashes like eczema, psoriasis. In the summer, we see a lot of poison ivy. And then lesser known is that dermatologists also study and take care of patients with hair loss conditions and nail disorders. So one of the reasons that I became a dermatologist and that many of my colleagues become dermatologists is that we like that the skin is the largest organ, most accessible, most visible, and the skin offers a lot of clues for what's going on inside the body as well. So we'll touch on that a little bit more in a little bit more later. So the second topic I'll be discussing, in addition to what dermatologists do, is how about skin and Myri syndrome. What do we know? Well, the short answer is not a lot. I'll go over some of what we do know. So Myri syndrome, as you probably know, is a connective tissue disorder. And skin, I just mentioned, is one of the largest organs. It's also a connective tissue organ. And so the skin in patients with Myri syndrome seems to get thicker or more fibrosed over time as people get a little bit older. And so we know this both from touching the skin of patients, but also doing biopsies. So researchers have taken little pieces of skin from patients at different ages and compared it to people who don't have Myri syndrome. And you can see here in some of these pictures that I've shown you that microscopically, very, very detailed view. On the left, you see that the collagen fibers, which is this fiber that makes up skin, seems to be more tightly packed in patients with Myri syndrome than people without. And then on the right is a very even higher, more technical type of microscopy called transmission electron microscopy. It can get really, really detailed. And in addition to the changes in the collagen fibers I mentioned, the elastic fibers seem to be abnormal as well. And so there's this progressive fibrosis or thickening that we've observed and that we've seen and that we feel. I haven't included any pictures of patients' skin here because I don't think it's something that you appreciate by seeing, although potentially patients with Myri syndrome seem to have fewer wrinkles than other patients at the same age. So there is still a lot more we need to know. It seems that patients with Myri syndrome have poor wound healing, but we still need to know a little bit more details, like at what age does this seem to be a problem? For what types of surgeries? Where on the body is wound healing a particular problem? So there's still a lot more questions than answers, unfortunately. And I'm hoping that you will generously help provide some of these answers as we start to study Myri syndrome in greater detail, so that we can offer better answers to the later generations of patients with Myri syndrome. There was a question about if there's anything that can be done to prevent the thickening. And there was one very, very small study of just 4 patients where they took a blood pressure medicine called losartan. And again, this is off-label. It's meant to treat blood pressure, but this was used in this study. And it seemed that after taking the medicine for 12 months in these 4 patients, there was a scale that we would use to determine how thick their skin is. It seemed that that number went down or improved, so their skin became less thick. But again, a lot more studies are necessary before we recommend this medicine to everybody. And so the long-term goal is that there would be some medicine that would help with some of the other issues found in Myri syndrome, as well as the skin, and we could potentially use the skin as a measure of sorts to see what's going on inside, since the skin is more accessible than the internal organs. But again, a lot of potential future work to be done. So because there's not a ton known about Myri syndrome and skin, I want to move on to some of the questions that were submitted prior to this summit, this virtual summit. Thank you so much to everybody who submitted questions. So one of the questions is dry skin more common in patients with Myri syndrome, and what can be done about it? So dry skin is pretty common everywhere. It's not known if it's more common or more severe in patients with Myri syndrome. It's particularly common in Boston, where I practice, especially in the winters. And so you want to do the basic things like make sure you're hydrating within sufficiently. As far as things that you can do from the outside, you want to use moisturizers, but I think it's helpful to go into a little bit greater detail about which moisturizers. So a lot of patients don't know that we need to separate moisturizers into 2 categories: humectants, which are meant to help attract water, and what we call emollients, which are more fat-based, like the skin, to trap that moisture. So if your skin is very dry, you want to use, especially if it's sort of heat-induced in the winter, you want to use a humidifier in your bedroom, especially while you're sleeping. And then after a shower, while the skin is still a little damp, it's very helpful to apply something called a humectant onto that damp skin to help absorb the water. So humectants are generally made of things like glycerin and hyaluronic acid. And again, I don't represent any companies, but these are 2 particular common over-the-counter products found in most American drugstores, with hyaluronic acid and glycerin. And then after that has soaked in, you can apply an oil-based moisturizer called an emollient, like the ones on the right part of the screen. Now, moisturizers come in different types. And so what I've listed is that lotions are generally the lightest and soak in the most rapidly, followed by creams, kind of middle of the road, perfect for summer. In the winter, though, both lotions and creams might be too light, and you might need to use an oil or a heavier balm or an even heavier ointment. So ointment would be like Aquaphor or Vaseline, really thick, really oily, and it helps seal the skin to trap that moisture inside and to prevent evaporation and help seal any cuts and scrapes. Now, if your skin is very dry and you're a little itchy, a little peely, and you just don't like that extra shedding, there are mild skin appropriate acids that can help with that rough feeling. So the active ingredients you're looking for are ammonium lactate, urea, alpha hydroxy acids, and salicylic acid. Again, I've given you some just American examples here if you are at the store and just don't know what to grab. If you are putting it on very sensitive skin though, some of these products might sting a little bit. So cautiously try it, say on your bottom of your feet, on your hands before you put it more widely. And I usually don't recommend putting this on your face unless your face is very, very scaly. So part of the reason that you want to keep the skin moisturized and not too thick is because skin that is too thick will split or cause cuts and fissures. And I don't know if any of you have had that happen to your hands in the winters. That can be very painful. It can bleed. And so if that happens, you can actually, crazily enough, use crazy glue or some type of super glue to seal that cut skin so that when you do expose that cut to water, say you're hand washing or using hand sanitizer, since COVID-19 is still problematic, it helps prevent that burning sting sensation. So this is, again, not what it's intended for, but many dermatologists do recommend this because it's essentially the same active ingredient chemical as what we use when we use skin glue for certain kinds of cuts. Although this isn't exactly the same thing, it's not sterilized, but this can be very helpful for many patients for cuts. So again, prevention is the best. So try to prevent cuts and fissures and splits by keeping the skin soft with the moisturizers we talked about and not too thick, like on the backs of your heels. So there was another question about what are optimal good habits for skin. And what I can say is that we recommend the following things for most people. So we recommend sun protection because the UV in sunlight can cause skin cancers, which would then require surgery. In addition, UV seems to break down collagen fibers, thus thinning the skin for most patients. I don't know if you've seen patients who have the really thin skin on the backs of their hands or the backs of their arms from chronic sun damage. We don't recommend smoking. It's bad for your lungs, gives you lung cancer, but also breaks down collagen fibers and makes your skin thin. For many patients, they want more plump sort of unwrinkled skin. And so for those patients, hydrolyzed collagen powder does seem to be a little bit helpful. We recommend Mediterranean diets high in omega-3 and other nutrients. These nutrients are helpful for the production and the maintenance of skin, hair, and nails. Because generally patients who are protecting their skin or staying out of the sun, they can become vitamin D deficient. And so the other way of getting vitamin D besides getting it from the sun would be from your food. And so vitamin D rich foods include fish, egg yolks, and mushrooms. Now, I don't know if all this can be applied to patients with Myri syndrome because the issue is not so much the skin thinning, but skin thickening. Nonetheless, so I would say probably don't take hydrolyzed collagen powder if you have Myri syndrome, because we don't want to exacerbate the skin thickening. However, I still would not recommend going out in the sun and smoking to try to thin the skin, because the negative aspects of those habits most likely outweigh any good. If you get skin cancers, you're going to need surgery. And we already mentioned how the skin in Myri syndrome doesn't seem to heal particularly well. And then obviously smoking can cause a lot of harm. So while these are things that most people do to keep their skin nice and plump and firm, and that might not be a problem in Myri syndrome, still not recommended to go against these general rules of thumb for skin health. There was a question about whether hair loss is more common in patients with Myhre syndrome. And again, we simply don't know. Is it more common? Possibly. We should look at it. Why do patients with Myhre syndrome lose their hair? We don't even really know why. Is it because it's a male or female pattern hair loss? Is there inflammation causing hair loss? Is the thickening of the skin causing scarring at the hair follicle, thus replacing the hair follicles? So we don't really know. It seems like in some patients, it might be male or female pattern hair loss. And if so, does it seem to happen earlier than expected for their family history? We simply don't know. And we're definitely very interested in finding out more. And so A pretty safe over-the-counter treatment for many types of hair loss would be minoxidil. The brand name is Rogaine. This is a topical medication that comes in both liquid and foam. The main downside is it can be irritating, so ease into it. Don't jump right into twice a day application. Start a couple times a week. The foam is a little less irritating, a little more expensive than the liquid. And then the second most common side effect is if you're messy with the application, you can cause hair growth in places you don't want. Say if you drip it down on your face onto your face and give you unintentional sideburns. So again, it would be wonderful if we started thinking more systematically about what is a problem in Myri syndrome, and then starting to gather that information so we can possibly in the future do something about it. So please reach out to us about things that you notice, whether or not you think it's related to Myri syndrome, since we need to collect a lot more information. There was a question about nail fungus and Myri syndrome. Now, again, like the dry skin, nail fungus is super common. There's so much fungus among us. And so there was one study that showed a possible abnormality in these little blood vessels at the nail folds. And the authors of that paper hypothesized that there may be some poor circulation of the nail folds. And so if that happens, it's possible that nail fungus is a little bit more common. But again, nail fungus is so common among everybody that it's hard to say for sure. So as to what to do about it, I would say it's probably important to visit a dermatologist. We can do scrapings, we can do clippings to see what type of fungus is causing the problem, because we do treat yeasts and what we call dermatophytes, a different type of fungus, differently. As far as over-the-counter things that are safe and easy, I would say dilute vinegar soaks is a very common, very traditional remedy that can be very helpful. The only caution is if you have any cuts or dry skin, it can sting a little bit. So it's definitely dilute the vinegar, don't go straight in. And then the other thing I want to mention is that toenail fungus in particular is very hard to treat. The fungus is kind of under the toenail, and so it's very hard space to access, even with the soaks, even with oral pills, and definitely with topical nail polishes or creams that you might get over the counter at the pharmacy. And toenails take many, many months to years to grow out, and that's another cause of the difficulty in treating toenail fungus. And so it's definitely something that can cause pain. And so if it at all is a problem, please see a dermatologist. We can better diagnose the problem and talk through the treatment options. While the oral antifungals can cause liver dysfunction, it's pretty rare. And so if the toenails are severely problematic or you just don't like them, we can definitely prescribe oral antifungals safely. And go and talk through the potential side effects to look for. One piece of practical advice I like to offer for people with toenail fungus is to change the order in which you get dressed. I know it sounds a little crazy, but if you put on socks before you put on underwear and pants, that can prevent the spread of the fungus onto your legs, onto the groin, and prevent spreading of the fungus that way. So that's just one little piece of advice. If you have toenail fungus, and you can use the dilute vinegar soaks while you're waiting to see a dermatologist, but also put on your socks before you put on your underwear and pants, and obviously shoes as well. So in summary, I talked a little bit about what you might expect if you come see a dermatologist, what is known about the skin and Myri syndrome, and all the things that we're hoping to gather more information about with your generous help, and some questions that participants submitted ahead of time. So hopefully you found this talk helpful. I look forward to meeting you in person if possible, and I'm excited to see what kind of research and new ideas that we can all come up with working together as patients, as advocates, as doctors who are interested in Myri syndrome. Thank you again for your attention, and I hope you have a wonderful rest of your day.